Welcome to Transitioning to Medicare Part 2. My name is Lois Romeo, and I'm a volunteer with the SHIP office. That's the State Health Insurance Assistance Program. For those of you who have done Part 1, this is local help with Medicare. It's no cost, it's confidential, and it's unbiased. We have one full-time employee that works with this, who's the main person. That's Nicole Renewal. And then the rest of us are trained counselors who are volunteers and have gone through training and had to be tested on what we know so that we can help you all. We can do education, one-on-one counseling. That has to be by appointment, not in the office these days. Right now it's by phone. We can look at your benefit program review. That's both the Medicare side, and if you have a retiree plan and need to do some comparisons, as long as you have the data, we can look at that with you. We can also help you with any kind of problem resolution or application assistance. It is available to all Carroll County residents. If you have friends who would like to have the same kind of help, this is a national program, so each county has its own SHIP office. This just gives you the phone numbers in case they're trying to locate in their particular county. So what are we going to talk about today? Last week, we talked about enrollment and some of those kinds of things and how do you get your Medicare card and what should you sign up for. This week, we're actually going to talk about the gaps in Medicare, talk about a Medigap coverage and other ways that you can supplement Medicare, such as Medicare Advantage plans, health plans, and Medicare savings programs, as well as then reemphasize how important you play in the role of helping with healthcare fraud and abuse. So this will be a bit of a repeat from last week, but you can choose the left-hand side of this chart or the right-hand side of this chart. If you go with original Medicare, which a great majority of our folks in Carroll County have done, you have Part A and B, hospital and medical insurance, covered through and administered by CMS, Centers for Medicare. If you decide that you can't afford or don't want to be paying the deductibles and coinsurances, then you might decide to pick up a Medigap or supplement or secondary. And then thirdly, you would decide to pick up a drug plan if you do not have other credible insurance. So the reason so many of our folks pick the left-hand side is Part A does not have a premium for most people. Part B, you know what your premium is. The Medigap, you know what you're going to spend on that in a given year by the time you pay your premium and any coinsurances depending on the plan. And Part D, we can run a comparison for you on your particular drugs, where you pick them up, and we can tell you pretty much what you're going to spend for the year. So it's pretty predictable if you can afford to have a Medigap. Without that, it's less predictable. On the other hand, people will choose a Medicare Advantage plan, and that's a little more like what your employee plans have been, either an HMO or a PPO, and we'll talk more about those when we get further down the presentation. But they will combine a Part A, a Part B, so your hospital and medical insurance, and most of them will have a Part D plan. The important thing to know on the Medicare Advantage plan is that if you have a Medicare Advantage plan, you may not pick up a Medigap or supplement plan to pick up your coinsurances. The reason we have folks who will pick those plans will be because they have some options to get some additional benefits you don't get under original Medicare, such as broader coverage on vision, dental, and hearing. So let's go back again just under original Medicare so that you know what the deductibles and co-payments are. Again, for hospital insurance, it's premium free if you or your spouse have worked 40 quarters or more and paid into FICA. But the first thing that'll happen if you have no other coverage other than Part A and B Medicare, then you would be responsible for the first $1,484. That's your deductible for Part A per benefit period. A benefit period is defined by the last time you got out of either an inpatient hospital, so you've been checked into the hospital actually, and or you went to a skilled nursing facility afterwards, whichever one you got out of last. If more than 60 days have passed, then you start a new benefit period, which means you start all over again with being responsible for the $1,484. Once you've covered that in a given benefit period, then you have 60 days of hospitalization that Medicare will cover with no coinsurance from you. And that does not have to be 60 days in a row. It can be 5 days in, 10 days out, 5 days in, that type of thing. And then after that, if you had to be in for more than 60 days within that benefit period, then you're going to have some heavier, you'll have the coinsurance, the $371 per day. And if you have a really extended stay within a given benefit period, you might start working against your 60 lifetime reserve days. So whereas the other categories are within a given benefit period, the 91st through 150th day, that's a one-time use of those 60 lifetime reserve days. And as you can see, you pay a pretty high co-payment on those, coinsurance. If you've been admitted for at least 3 full days to the hospital, inpatient in the hospital, so admitted, not counting the day you get discharged, then if you go to the skilled nursing facility, you have 20 days of coverage there with no coinsurance. After that, you have a coinsurance. If you were not admitted for at least 3 full days, then you would not have that coverage in the skilled nursing facility. So it's very important that you pay attention and make sure you ask them at the hospital. If you went into the emergency room, they're required within 24 hours to tell you whether you're under observation or whether you've been admitted. So just make sure you know that answer so that you don't have a surprise later. So that is Part A. You can have more than one benefit period per year. That does not go in the calendar year, it goes by benefit period. If you switch down to Part B, think of it again as everything other than basically hospital or hospice or certain home health care. Then you're now dealing with your labs, your x-rays, your doctors, your cancer treatments, everything like that, dialysis, outpatient surgery, wheelchairs, all of those kinds of things fall under Part B. Everything else except your prescription drugs. If you are currently taking Social Security, you will pay $148.50 per month. That'll come right out of your Social Security check before you ever receive it. That may be income adjusted if you make more than certain amounts. I'm not going to talk to those amounts, but you'll have copies of the presentation. If you look at the last 2 charts, it'll show you what that income adjustment could be. There's a Part B deductible. I'm sorry, on the standard premium, if you are not currently taking Social Security, you will get actually a quarterly bill for 3 times that amount. There's also a deductible for Part B. So the first time you go to the doctor's labs, et cetera, that you spend $203, you're responsible for that, again, unless you have a plan that picks it up. And that'll be your deductible for the year. After that, Medicare will pay 80%, beneficiary will pay 20%. Unless you go to a doctor or facility that does not accept assignment. What that says is they have not accepted the rate that Medicare will pay for that procedure. They can then actually charge up to 15% higher. So if it's an approved amount of $100 for that by Medicare, then they could charge up to $115. So if you go to someone who accepts assignment, Medicare is going to pay $80, you'd pay $20. If you go to someone who does not accept assignment, Medicare is still going to pay the $80. You're still responsible for the $20, but you're also responsible, again, unless you have a plan that picks it up, for the other $15 they might charge. So you could be responsible for a total of $35. So what are your out-of-pocket costs with original Medicare? Well, it's very dependent. It's dependent on the type and frequency of healthcare you need. You should check whether your doctors, facilities, et cetera, accept assignment. Most of them do. We don't run into this too often, but it's worth knowing up front, and then you can at least make a conscious choice. And it also is dependent on whether you have other health insurance coverage. This is where the Medigaps come into play. So the Medicare Supplement insurance policies are sold by private companies. They're designed to pick up depending on which plan you pick, the deductibles and the co-insurances, the 20% on Part B, for instance. That's what they mean by a gap. Just be aware your Medigap policy will not pay for anything that original Medicare did not pay for the base amount on it. So if it's not something that's covered, a procedure, et cetera, like getting changes made to your face or that kind of thing, original Medicare does not cover that. Excuse me. And neither will your Medigap pick that up, the differential on that. If the other thing that's important to know about Medigaps is they are standardized plans. Every plan that has the same letter has the same coverage. That's all defined by Medicare. The only thing that's different would be costs from plan to plan. So one of the questions is whether a Medigap policy is right for you. So it definitely can lower your out-of-pocket costs. And again, you'll notice the different names here. Medigaps get referred to as supplemental, secondary, Medigap. They do have a monthly premium payment that's tied into it, and they only work with original Medicare Part A and B. There's some of you that will not need a Medigap, and those would be folks that have other health insurance that acts as a secondary to their Medicare coverage. So that could be an employee retiree plan. Most people who have worked for a state or federal government or the military, or even people with COBRA may not need a Medigap because of the plans they have that act as a secondary. So these are the Medigap plan types. If you look at the left-hand side of the chart, you'll see the co-pays and deductibles that we saw in the earlier charts. Going down the left-hand side. If you go across the chart, the plan types you can get are the letters that are listed. Most of you would, unless you're under 65, and have hit the 25th month of being on disability, you will normally not pick plan A or D, A, B, or D, because those are plans that are available only to people that have a disability and are under 65. So therefore, they are typically more expensive on the premiums because they're doing more services for their beneficiaries. The two plans I'll talk to briefly are Plan G and Plan N. If you look down the X's under Plan G, you will note that there is an X in every row except the Medicare Part B deductible. So anybody that was eligible for Medicare after 1/1 of 2020 can only pick these plans. If you happen to have been somebody who hasn't gone on Medicare yet, but were eligible before that, then you have the option of a Plan F, which others may have talked to you about. As of those new plans of 1/1/2020, no plan covers the Part B deductible. So if you have a Plan G, you're going to have your Medicare coverage, and then any of your other, except that $203, anything other than that, your Plan G will pick up the co-insurance or deductible. So as you can imagine, therefore, it's also the most expensive premiums you're going to hit. Another plan that many people pick is a Plan N. And if you go all the way to the right-hand side, you'll notice that it does not pick up the $203 Part B deductible, just like all the other plans. It does not pick up the excess charges. So if you choose to go to a doctor or facility, you could have to pay that extra 15% that particular facility or doctor charges, because it will not get picked up by your Plan N. You also have a copayment. So when you go to the doctor's or the emergency room, for a doctor's visit, you're going to pay up to $20. For emergency room, you're going to pay up to $50 unless you get admitted to the hospital. You don't get charged that if you get admitted. So you'll see as we go through some examples in a little while that the Plan N will have a lower premium, but then you have some other co-insurances that you're responsible for that you aren't in a Plan G. So what's your best way to find the right Medigap policy for you? There are two websites you can go to, the Medicare.gov site and the Maryland Insurance Administration site. I highly recommend going to the Maryland Insurance site for two reasons. One, you can look at either one to start comparing and see what companies that can actually offer you a Medigap in the state of Maryland. But the reason I recommend you go to the Maryland Insurance site is because you can also there see all the listing for the annual premiums for the policies you may be interested in. So I just think it gives you a broader set of information and coverage. The companies that are listed in the book and online all have to go through an annual review by the Maryland Insurance Administration to make sure they're fiscally responsible, to figure out if they have paid out more claims than they expected and therefore might be eligible for a rate increase, etc. So these are all reviewed regularly. So who is eligible to buy a Medigap? So first off, you have to have Medicare Parts A and B to be able to buy a Medigap. Secondly, these are individual policies. I know most of you are used to family coverage in an insurance policy of health insurance. In this situation, you are each buying everything in Medicare, you're doing an individual. You might get some discounts if you're both with the same company, but you're always dealing with separate individual policies. So what is medical underwriting? This is a process to look at your health status and your medical history. The reason you care about this is during your personal open enrollment periods, you have something called guaranteed issue rights. During that time, there is no medical underwriting for you. So when's the best time to buy a Medigap? It is during your personal open enrollment period of guaranteed issue rights. And the reason it is not only will they not do a medical underwriting, therefore every 65-year-old person who goes in, who has that and Part B, their pricing is going to look the same. If they're a male, they're going to look, a male non-smoker, they'll all look the same. If they're a female non-smoker, they'll all look the same. So it doesn't matter if your health is great or if it's not so good. You're going to get that same rate during your guaranteed issue right period. And that period is 6 months, starting from when you are 65 or older and you get enrolled into Part B. So this is the reason a lot of people choose not to be enrolled in Part B, because for two reasons. One, if they're still working, while they're still working, because they don't want to be paying for the Part B premium if they have other coverage. And secondly, they don't want to have their guaranteed issue right period kick in. So it also will be the first 6 months you're under 65 and have Part B. So again, that's only Plan A and D. If you're doing that one, that means you've been on disability and you've hit 25 months. However, if you know anybody or if it applies to you, you actually get a second open enrollment period with guaranteed issue rights for 6 months. And that is actually when you turn 65, because the plan you'll pick on disability is going to be quite expensive. You'll have the option to pick one that looks like everybody else's, a different one if you want. And most people would choose that when you turn 65. So just make sure you take advantage of that. So, you know, after that open enrollment, your open enrollment, then, you know, you no longer have those guaranteed issue rights. You could still apply. So first off, when you're picking a Medigap, you're going to spend some time to do this and look at it carefully. You can apply for a Medigap at any time. It doesn't have to be during the annual open enrollment period. It can be any time of the year, anytime you want. The challenge is that company can require medical underwriting after your open enrollment, and you can be turned down or charged more because of your medical history. So again, during your guaranteed issue rights, they have to give you the policy if you pick it, and you're going to be at the lowest rates. So if you choose to look for a different Medigap down the line, just make sure you don't cancel your current policy until you know you have that new policy. There are a few situations where you would have guaranteed issue rights, not for 6 months, but for 63 days. And you'll see in down lower on the chart in the green where it says choosing a Medigap policy, that is a book. That's a link that we have here for you to get to that book. I highly recommend, as you're picking a Medigap or as you're trying to understand guaranteed issue right periods, that you go through that book. It'll help you decide, do you want a plan G, a plan K, a plan N, etc. It's also going to make it very clear when you have guaranteed issue rights. So everything we've talked about in here will be done in more detail if you look at that. So if you have original Medicare and an employer group plan that pays after Medicare, if that plan is ending, then you have 63 days to pick, with guaranteed issue rights, to pick a Medigap. If you have a Medicare Advantage plan that goes away, so these are different choices within different counties. We have gone through cycles where one is no longer offered in Carroll County. Those folks then had the choice for 63 days to pick up a Medigap instead, or to pick another Medicare Advantage plan, but they had the guaranteed issue rights for 63 days. There are two cycles where if you either dropped a Medigap policy to join a Medicare Advantage plan, and this is only the first time you would ever choose to do that, if you've been on that plan less than a year and you want to switch back, you have those 63 days. The other time is if you joined a Medicare Advantage plan right up front when you were first eligible and you decide it's not working for you and you want to go to original Medicare. Again, within the first year, that's the other time you again have guaranteed issue rights. So Medigap policy ratings are rated one of three ways. They're either issue age, attained age, or community rated. We have almost no issue age. You'll see one or two options in there on certain plan types. And that is based on the age when it's purchased. So the premiums can increase when there's an across the board premium increase, but they're not going to increase just because you got older. Attained age, which the great majority in there are, that you'll see in the pricing are, that premium is going to go up automatically as you get older. You know it's going to go up. And then community rated, they actually group all men non-smokers together, all women non-smokers together, and there will only be one rate set there. So that can work to your advantage if you expect to live a long time. Might not work as much to your advantage when you're younger, but I'll show you how they deal with that. So what's going to cost you? There's a lot of different factors. Your age, who you buy it from, because again, these are private companies, they do their own pricing. You will want to go to the annual premiums booklet and it lists all your yearly premiums. There will be a new book out shortly, and online you can probably already find the 2021 rates, but we don't have the books yet for that. It's going to depend on the type of policy you purchase. If it's during guaranteed issue rights, it won't depend on your health, but at other times it will. And it's going to depend on the letter that you pick. So I think you've got this by now. It's a very important decision. Make sure you compare the companies and their costs. Choose the best policy for you. And again, use the book that we gave you the link a couple charts ago. And then you would contact the insurance company, complete the application, and buy a Medigap policy. We can enroll you in your Medicare at the SHIP site or at the central office. We can enroll you in either the prescription drug plans, and we can do the enrollment for you into Medicare Advantage plans. You have to do your own enrollment into the Medigap policies. So you contact that company. So how do you go about contacting the company? I'm going to show you 3 examples just so you know what to look at when you're seeing the pricing on these. So first off, if you look in the upper right-hand corner here, you'll see that it says it's attained age. So that tells you right there, it's going to go up with age. You'll see the categories male and female preferred. Preferred or basic will be the term they'll use of what you can use if you go onto Medicare up front when you're in your guaranteed issue right period. You'll also see down the left-hand side, and that'll become obvious as we look at different charts, Not every company offers every plan type. So if you look at the male preferred, for instance, in a Plan G, while at 65, you're going to be paying $153 a month for that premium. By the time you get out to 85, you're going to be paying $262 per month at the current rates. You'll also notice females are less expensive than men because we have better records as far as our health as we age. If you look at the bottom, you will also see that there's a 7% discount on this particular company if you have more than one person in the household who has their Medicare option through their Medigap option through this company. The other thing I'll just point out to you is we talked about a G and an N. Well, you can see looking at this down under female preferred, a G goes from $133 at 65 to $228 at 85, whereas an N is net $95 and goes up to $172. So when you're considering this, and the book we referred to earlier helps a lot on choosing a Medigap, it's going to help you make that determination, which makes more sense, not just price, or even considering a high G, which is much lower premium, but you pay more upfront. So in looking at that, for instance, if you're somebody that goes to physical therapy 3 times a week, almost every year, for months because you have joint issues, whatever, you might say, wow, by the time I pay that $20 every time I go in for a treatment, that's going to make it, cost me more per month than getting a G that's going to cover that. So those are the kinds of things you're going to want to take into consideration. This is another company. And again, it's an attained age. This one, just to show you on the bottom, it has a different discount. And as you can see, it's different pricing than the chart before this. And here they list male non-tobacco, female non-tobacco versus the premium. They would also have a table for people who use tobacco. So when you're in your guaranteed issue right period, that's one of the, pretty much the only health question they can ask you. They can get your age, they can get your basic information, and they can ask you whether you smoke. And that will put you into a different category if you're a smoker. This one is the only company that is offered in the state of Maryland that is community rated. So as you can see, the tables look a little different. They've just got one base rate. They show a tier 1 and a tier 2, but they don't show you going up with age. And that's because there's just the one rate. You probably also notice here that if you look at a Plan G for either men or women, that looks quite a bit more expensive than the starting 65-year-old on the other page. It's the same thing with a Plan N. So if you look in the footnotes, and again, this is why it's important to look at your footnotes, you'll see that what happens for them to be competitive when you're younger, they actually give you a 39% discount off that rate for ages 65 through 68. After that, they start taking away you go up every year because they take away 3% of discount each year. Up until you reach 81, you have no discount then. Then you go to the rate that you see on their table. So that's where, looking at your family history, your health profile, etc., you can do some comparisons for yourself to say, look, if my family all lives to 100 and I think I'm going to live to 100 and I'm healthy, maybe a community rated is exactly what I want. On the other hand, if you have a lot of health issues, your family does not live a long time, etc., and you don't think you're going to, then you might decide, gee, maybe I'm better off with not a community rated. So how do you enroll in these Medigap plans? You can do it by going on. So after you've looked at the rates and done your comparisons and figure out the plan type you want, you can go out to the plan website and put in an application. What most people do, and the information for getting to them, both the web information and the phone numbers, are on those sheets. They were in that little box that was blued out on their chart. you would just call them very often. Some people, if they're going with a Care First, they'll actually go down to the site if they're letting you do that right now. But you can call the plan, they'll take your information over the phone, they'll mail it out to you, you sign it, send it back with a check, and you're in, you're done. You can also call us for detailed assistance. We're not going to do the enrollment for you, but if you're confused as you look at it or you have questions trying to understand it better, that's where feel free to call us to help you. Okay, so that's really talking about Medigap and focused on that. So now let's flip over to the other side, the Medicare Advantage plan. More like some of your plans that you've had working for companies. You can pick either an HMO or PPO. In both cases, you're going to have a network of doctors and facilities. In an HMO, if you go outside that network, then you have no coverage. You pay all the costs of whatever you're having done, other than for emergency or urgent care. In a PPO, you're still going to have that network, but if you go outside that network, then you're going to pay either a set fee or somewhere between 30 and 50% of the cost. So you're going to typically pay more than you will in network. These plans, as I said, cover Part A and B. One of the things people get confused about is, well, gee, do I pay this plan premium, and do I also pay for the Part B, the $148.50 a month? The answer is yes. You still pay for that. This does also, though, your premium does also include a Part D or a prescription drug plan on most, for most of our plans. So this is just an alternative way of getting your Medicare benefits. It's still your benefits as far as the services that have to be covered, etc. And things like benefit periods and that kind of thing are all still defined by Centers for Medicare. You're still in the Medicare program. You still get all the same Part A and Part B services. So if it's preventative under original Medicare, it's preventative service here. Individuals that do pick a Medicare Advantage plan cannot have a Medigap plan. So how do these work? Well, first off, again, they're run by private companies. They do cost sharing. So you're going to pay a monthly premium and co-payment or co-insurance for your services. There will be some out-of-pocket limits that we'll talk about in a few charts. There will typically also be geographic limits. So if you're a person who spends half your year in Florida, then this is probably not going to be, a Medicare Advantage plan is probably not going to be your best option because you're going to be out of network half the year. If you're even somebody that spends, travels all the time and is out of pocket from your home base, a good portion of the year, again, may not be a good option for you for the same reason. So you typically do have to use a network of providers, and some of them will require a referral to see a specialist. However, you can get some extra services that original Medicare does not cover. So under original Medicare, you do not have vision, dental, and hearing, other than for medical conditions. So if you go just for your eye checkup and want to get a new pair of glasses, you have no coverage for that under original Medicare. Same with your standard dental checkups. If you did go for surgery for cataracts, original Medicare is going to cover that cataract surgery. But if at the same time you decide to repair astigmatism with that, you'd be responsible for the astigmatism. So these Medicare Advantage plans, that's under original Medicare, these Medicare Advantage plans will give you some options either under their base premium or with an add-on you can do to it to give you broader coverage than you would have, and for some of the standard vision, dental, and hearing. So when can you enroll in a Medicare Advantage plan? You can do it when you first become eligible for Medicare. You can do it during the annual enrollment period each year. So whereas we talked about the Medigap and said, we really expect you to have, kind of pick something you're going to stay with probably indefinitely. That's not true with this. Just like with the prescription drug plans, these can change every year. So every year we recommend you look at these plans in the annual enrollment period, October 15th through December 7th each year. There also are a couple special enrollment periods, and it is important to actually review that every year. So what are the plan types that are offered in Carroll County in 2021? You'll see them listed here. In a minute, I'm going to show you a bit of a cheat sheet we do for ourselves and to give you a high-level understanding of what your costs might look like under a Medicare Advantage plan. I do not cover Kaiser Permanente on that, and that has nothing to do with them. They're a good company. They have very high quality ratings. The challenge for Carroll County residents is that they do not have facilities that are close in many cases. So for emergency care, yes, you could go to Carroll Hospital. If you're going for everything else, then you would go to one of their facilities, which could be Frederick, Glen Burnie, Northern Virginia, take your pick depending on what it is. So that's why we have very few people on that. The other one I'll mention on this page is the University of Maryland plan. It's transitioning to a Blue Cross Blue Shield plan, but that's only available for people who are full benefit dual eligible, which we talk about under the Medicare savings plans, but essentially that's about the equivalent of someone who would be eligible for Medicaid. So these are some of the plans you can choose from. First reminder, you still have to pay the Part B premium. Couple just how you read the chart in here. Left-hand side would be your choices other than the Kaiser, the plans that are available to you. Under the monthly premium, you're going to see H&D. That just stands for health and drug. The reason we split that out and then give you a total what your monthly premium would look like is because if you qualify for Senior Prescription Drug Assistance Plan, it will pay up to $50 a month towards your drug plan. It's only going to apply towards the drug plan though. So for instance, if you go down to Johns Hopkins Advantage PPO, third from the bottom, that's a $91 monthly premium. 31 of that is the drug plan. That's the portion you can apply your senior prescription drug assistance to. So it would pay $31 of it, you'd be responsible for $60. On the other hand, if you look up at Care First Advantage Enhanced, $45 of it is the drug part. It's going to pay the $45. So it just totally varies depending on how that particular company charges their premium. So this gives you an idea. As you can see, the range on this is anywhere from $35, well, zero actually. That one, note that there is no drug plan. If you happen to pick Humana Honor PPO, the main people that might pick something like that, since they can't pick up a prescription drug plan then, would be people that have other drug coverage, whether that's through the VA or whether that's through something from a former employer, et cetera. As long, so they don't expect to ever use a drug plan through Medicare is what that's typically going to be. Outside of that, your premiums will range from $35 to $121, which is why at some point you're going to want to go into the details on these and understand the differences. In the deductible column, you'll see that many of them have a zero, but again, there can be a deductible on the health side and a deductible. If it just says zero, there's no deductible on either. Otherwise, you'll see some pricing in there that says there is a deductible and it's different for the health and the drug prescription side. The maximum out of pocket. So maximum out of pocket is as you've paid you're still going to have the same concept of the 80%, 20% kind of coverage. Medicare, Medicare Part B is still going to pay that 80%. And then you're going to pay some copay under this or coinsurance. As you pay those co-insurances or deductibles, that starts counting towards your maximum out-of-pocket for the health medical side. Keep prescription drug totally separate. The max out-of-pocket, if you stay totally within network, then you'll see it can vary. If you look down the chart, it can vary from $6,550 a year to $7,550 a year. After you reach that maximum out of pocket, then your plan would pick up your costs again, other than, as long as it's a service that's covered, other than your prescription drug side. Where you see the NAs, you'll notice that's on all the ones that are HMOs. And that's because there is no out-of-pocket limit for you for an HMO, because you're paying all the costs. It doesn't matter how much that is. On your PPOs, you'll see there's an out-of-pocket limit for out. And out here stands for whether you've used some in-network and some out-of-network. As soon as you've hit any out-of-network doctors or facilities, then the out-of-pocket limit that you would use would be the one listed next to out. So that could be anywhere from $10,000 to $11,300. So again, that can vary by plan, obviously. I'm going to shift all the way to the right-hand side of the column for a moment and look at doctors for you, because that's one of the ones most commonly used. Primary care physician, you'll see, can range from you pay nothing to that primary care physician for a visit to up to $20, depending on the plan. Specialists are going to be more expensive. The lowest cost there would be the $30. Out of network, you can pay 35% on some, up through 50% on some. And then specialists in network, you'll see that many of them have a $50 charge for any time you're going to a specialist in network. So, and again, not to be confusing here, but where it says 100%, that's on an HMO, because if you go out of network, you pay the whole cost again. So let's just look at inpatient hospital for a moment. You'll see it's a little different model than the original Medicare. So these programs all charge you per day. So if you went in for 2 days, or had been into the hospital for 2 days, it would be 2 times that figure. If you go up through the first 6 days, 5 on some plans, 6 on other plans, then it's going to be 6 times that figure. So you'll notice by the time you do the math of the 6 days times $310 per day, for instance, that you will be at $1,860. That's more than the $1,484 that you would have paid under original Medicare. However, you can go the full 90 days and not have, in a benefit period, and not have additional payments that you're responsible for. So I'm going to flip to the next chart. Okay, so on here, I'm just trying to show you some of the other, it's still the same companies. I'm just trying to show you what would happen if you go to emergency or urgent care or do things like your lab work. So you'll see there's a consistency across these. If you can go, they want you to go to the closest facility if you have an emergency or urgent. So there's not a difference between in-network and out-of-network for emergency and urgent. 2 things: they have to treat you, number 1, and number 2, you're going to, pay these particular fees that are spelled out for you on the chart. You'll see that in some cases, you don't have a co-insurance like you do under original Medicare. So if you go over and look at lab, a number of these don't charge you as long as you stay in network for lab work that you have done. In others, you're going to pay some kind of fee. If you go out of network again, you're going to pay more. So if you go out to the Medicare.gov site and do a comparison, you can run a comparison just like you run a comparison for the drug plan. You can run one for these Medicare Advantage plans. It would allow you, you can compare 3 at a time, and it will allow you to not only compare 3 different companies to get a better view, but every one of these categories you can go into much more detail on. So it will define more for you within that. This is just to begin to give you a start. So all of the figures that you see where it's a, if you have an MRI done, that's $200 towards your out-of-pocket limit, because that's a co-insurance that you're paying. So, this is, again, just to get you started on understanding what your costs might look like under a Medicare Advantage plan. But either through us or on your own, you can run a comparison that will give you much more detail on that. This is a fairly new option you can pick. It's called a Medicare Savings Account. This actually looks somewhat like an HSA you might be used to in the private sector. It takes a high deductible insurance plan and puts it with a medical savings account. You're still going to pay your Part B premium. It does not have a prescription drug plan. However, you can sign up for a prescription drug plan if you pick an MSA. The plan is going to set up an actual account for you that's for your health expenses, and it's going to put an annual deposit in there. You're able to use that towards your health expenses, including over-the-counter kind of expenses. Any money you don't use from that annual deposit actually accumulates across years. So let's say you have a pretty good year and don't spend much of it this year, and you start off next year with what you did not spend of that deposit this year. The providers are required, they cannot charge you more than the Medicare approved amount. So you don't have to worry if you go to a doctor or facility that all of a sudden they're going to be charging you something different than the Medicare approved amount. They are not allowed to do that. There are restrictions on who can pick an MSA. So if you have an employee or union retiree plan, TRICARE, VA, federal health benefits, if you're under hospice care or you're eligible for Medicaid, under those conditions, you may not pick these plans. But the way they work, if you pick one of these 2 plans, you'll see they're either going to make an annual deposit into this account for you of either $2,000 or $3,000. You then can use that money, and you may spend it all, you may not. If you keep spending and have to spend more than that amount that's in there, you're responsible then for the next either $3,000 or $5,000, depending on which plan you take. After that, then the plan will pick up your expenses. So you could think of the annual deductible as being your max out of pocket is that, the annual deductible, or really the annual deductible minus the deposit that was put in there. So this is just another way or a different way to be able to get your satisfy what you're trying to do. And again, this would be more for people who are comfortable doing a bit more paperwork probably, but secondly, that have a little more disposable income that they know they can meet those upfront costs. Okay, so Medicare.gov. When you first get onto Medicare, or if you come to us to get help and you have your Medicare number, if you haven't already created an account, we're going to help you do that. So you would go to that little blue box in the middle and say create account. And once you've set that up, you don't even have to be putting your Medicare number in. You just need to know your login information for that account. And there's a lot of things you can do once you've created that account. You can manage your prescription drug lists and your other health information. You can choose, if you want to, instead of getting all the paperwork that comes out to look at your Medicare summary notices of your claims, you can actually view all that online if you prefer. So if you're like me, I don't like getting all that paper. I just as soon look at it online. I know I can go find it easily if I need to go back to it, that type of thing. You also can see your eligibility and what the preventative services are. You can even choose, if you want to get the book that comes out each year for you, that you get once a year describing all of your Medicare benefits. You can choose to even just have that online if you want, which again gives you search capability easily on it. You can also see your Part B deductible. You can also determine if what's showing on the system is what you're expecting for both your health and prescription drug enrollments. There is a link that we include here, and you can go to that, and that will help you determine. I'm going to go back to this chart for one moment. Once you log in, you'll get a chance to do the drug and or Medicare Advantage plan comparisons we talked about. And it will walk you right through that process. It's very easy. First or second time you might do it, or forever if you want to do it that way. We can help you. We can run those comparisons for you, and we can enroll you. Okay, this is a chart I'm not going to spend time on. It's kind of a good summary. I personally think it can be a little bit misleading at times, but it's a Medicare chart you can review, and then if you have questions on them, feel free to call us and we can walk you through anything we need to on this chart. So, information sources for your Medigaps and your health plans. Again, the Maryland Insurance Administration site. There's a phone number where you can call, or you can go online with them. And that's where I would recommend you look at the Medigaps in particular, because it has that annual premium information. You can look at Medicare.gov, and that's going to help you find your Medicare Advantage and your prescription drug plans for your area. And it's also you can look at the Medigaps on that one as well. You can call us and set up appointments, and we can do that with you. And then you can call Central Medicare, and they can help you with these as well. So there's a lot of different ways you can approach this information, and we want you to make the best decisions, and the best decisions for you are going to be individual. And so we just want to make sure you understand what you're looking at. If you have any questions, please do not hesitate to ask us to repeat ourselves or explain something a different way. We will be glad to do that for you. So some of you will qualify for a Medicare savings program. These are the 2020 guidelines. We don't get the new guidelines for 2021 until sometime in the spring we'll get them. But in the meantime, the way you look at this chart is the first three programs on this are federal programs. They have, as you'll see, an individual or married monthly income limit. They'll have an asset test. A QIMBY, or qualified Medicare beneficiary, is someone who's going to fall in the range of someone that would qualify for Medicaid. The way you think about asset versus monthly income limit. The asset, and this is a combined, even though each of you would qualify individually, it does look at your married monthly income limit. So it's combined for you and your spouse. Or someone else in your house, if you're dependent on each other, that type of thing. It does not include the asset test does not include your home if you have one, does not include your car, does not include a burial plot. It does include things such as a 401 or a 403, any of those kind of savings that you've put aside for your retirement. So if you're receiving for monthly income, if you're receiving pension, Social Security, rental income, anything like that, all of that's going to get included in your monthly income. The other thing that will get included there is a 401k if you are taking not the asset you have there, but a distribution you take from that will count towards your income limit. So if you look at these and you qualify both, you're below the income limit and would pass the asset test. If you're QIMBY, you actually would look very much like Medicaid and pay very little out of pocket. Your Part A and Part B premiums would be covered. Other cost sharing such as deductibles and co-insurances would be covered. At a little higher level on the income, you might qualify as a SLIMB. So that's a specified low income Medicare beneficiary. That's only going to pay your Part B premium. The third category there is Social Security Extra Help. You'll see again, the income limits and the asset limits are higher on that. If you qualify for QIMBY or SLIMB, you automatically qualify for Extra Help. It's designed to help you with prescription. So the prescription drug side of things, premiums, deductibles, copays. You may qualify for extra help even if you don't qualify for Quemby or Slimby. And we can help you fill out those applications or answer questions for you on that. The last category is a state program. It's the Senior Prescription Drug Assistance Program. We have many more people who qualify for this because there is no asset test. So this is, and as you can see, the monthly income limits are higher. And again, this is for each of you. If you have two in your household, you can each qualify for capturing $50 a month towards your monthly premium on the drug plan, that is. And that's why we showed you the separate numbers on the Advantage plans. So that could be up to $100 a month towards your monthly premiums if you were each to qualify for this. It also allows you to do one extra switch during the year on your prescription drug plan. So that can come in real handy if all of a sudden you get prescribed something that's not on that plan's formulary. Last but not least is the Senior Medicare Patrol, which we also do. And this is all about preventing fraud. So please treat your Medicare card just like you, and your number, just like you would a credit card. Look out for identity theft. Be aware Medicare is not going to call you. They're not going to visit you to sell something. So if anybody tries to do that, hang up on them or shut the door because it's fraud. Don't give out your Medicare number other than medical providers or to Central Medicare if they're helping you do something, or us at SHIP where we're trying to help you do something and we need that to be able to find you. But do not be giving it out to other people. Please, please review your Medicare summary notices. That's your statement that's going to show exactly what Medicare has paid on your behalf. So look, if you see things that you did not have done, or you see double billing, or you see things your doctor didn't order, or you don't recognize a doctor, which is a little harder when you've been in the hospital, but in general, you can do this, then pay attention to that. And the first thing you should do if you see something like that is call the provider, because sometimes it's just a miskeyed number or something. So, you know, sometimes it's easily fixed. A provider, you know, keyed something in wrong and it can just be pulled back off, right? If that's not the case and, you know, there's something that doesn't look right to you, then just have your information handy. You can contact your Senior Medicare Patrol. That Senior Medicare Patrol can be either us at the SHIP office or it can be Central Medicare. It's free, it's confidential, and, you know, we'll help you with whatever you need. You don't have to worry about, is somebody going to know I reported this, blah, 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 you know, et cetera. So, you know, please, 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 Medicare loses about $60 billion a year to fraud and abuse. And anything we can keep, you're the first line of defense, anything we can keep from being paid out incorrectly allows us to have better coverage and continuing coverage through our Medicare funds. So please help with that. You're the most important line of defense. Last but not least, we're the SHIP and the SMP office. This is our central number. If you want to call Nicole Renewal directly, then you can call at 410-386-3806. And again, we're free local help for people with Medicare. You may have questions, feel free to reach out to us. And just to show you, there are two charts at the end. These are the charts that spell out your income-related Medicare adjustment amount. And we appreciate your time. Thank you.